Welcome to my channel. Today we will talking about positions for client. Before we start the video, we will discuss about previous question. So question was, the nurse is assisting the surgeon in obtaining informed consent from the client for surgery. The client signs the consent and after the surgeon leaves the nursing unit, the client informs to nurse that he is unclear about certain aspects of surgical procedure. What should the nurse do? So answer is, nursing responsibility with regard to surgical procedure is witnessing the client signing of a consent form. The nurse must be sure that the client has understood the surgeon's explanation of surgery. If client has doubts regarding surgery, the nurse must notify the surgeon and will need to clarify anything that was not understood by the client and clear all doubts of the client regarding surgery and its procedure. The nurse should prepare the client psychologically and reduce the anxiety of client. So now we will talking about important nursing situations related to positioning of client. Question number 1. A client is being prepared for thoracentesis. The nurse should assist the client to which position for this procedure? Options are lying in bed with the affected side, lying in bed on the unaffected side, Sim's position with the head of the bed flat, prone with the head turned to the side and supported by a pillow. So correct answer is B, lying in bed on the unaffected side. The client should be placed lying in bed on unaffected side with the bed elevated 30 to 60 degree. And another position for this procedure is, the client is positioned sitting at the edge of the bed, leaning over the bedside table. To facilitate removal of fluid from the chest, the client is positioned sitting at the edge of the bed, leaning over the bedside table, with the feet supported on a stool. Question number 2. The nurse is caring for a client following craniotomy, in which a large tumor was removed from the left side. In which position can the nurse safely place the client? Here are the images of bed with positions: a bed with spine position, a bed with semi-fowler position, a bed with Trendelenburg position, a bed with reverse Trendelenburg position. So correct answer is B. Head of the bed should be elevated 30 to 45 degree. Clients who have undergone craniotomy should be placed in semi-fowler's position to promote venous drainage from the head. The client should not be positioned on the side that was operated on. A flat or Trendelenburg's position would increase intracranial pressure. That's why the patient should not be placed in flat and Trendelenburg's position. In some patients, we can place the patient in a sitting position, and the position depends on the site and type of surgery. Question number 3. The nurse creates a plan of care for a client with deep vein thrombosis. Which client's position and activity in the plan should be included? Options are out of bed activities as desired, bed rest with the affected extremity keep flat, bed rest elevation of the affected extremity, bed rest with the affected extremity in a dependent position. So correct answer is C, bed rest elevation of the affected extremity. Elevate the affected leg of the client. The client who has deep vein thrombosis elevate the affected leg because it helps to facilitate blood flow by the force of gravity. It also decreases venous pressure, which relieves edema and pain. Question number 4. The nurse is caring for a client who is 1 day post-operative for total hip replacement. Which is the best position in which the nurse should place the client? Options are side lying on the operated side, on the non-operated side with the legs abducted, side lying with the affected leg internally rotated, side lying with the affected leg externally rotated. So correct answer is B, on the non-operative side with the legs abducted. The hip should not be flexed, adducted and internally rotated because it may cause dislocation of the hip. Do not bend operated hip more than 90 degree. Do not cross the legs. The position for total hip replacement surgery depends on the surgical techniques used, the method of implantation, the prosthesis and the doctor's prescription and preference. Question number 5. The nurse is administering a cleansing enema to a client with fecal impaction. The nurse should place the client in which position? Options are left Sims position, right Sims position, prone position, and lithotomy position. So correct answer is A, left Sims position. The client should be placed in a left Sims position so that the enema solution can flow by the gravity in the natural direction of the colon. The head of the bed is not elevated in the Sims position during enema because it causes backflow of solution from the colon. Now we will discuss about important points regarding positioning of client. Point number 1. The head of the bed should remain elevated for continuous tube feeding to prevent aspiration. Point number 2. In irrigations, elevate the head of the bed to prevent aspiration. Point number 3. The client with respiratory and cardiac disorders should be positioned with the head of the bed elevated to facilitate breathing. Point number 4. If autonomic dysreflexia occurs, immediately place the client in high Fowler's position. If the patient becomes hypertensive, the therapist should place the patient in upright position immediately. This takes advantage of an orthostatic response and helps with the pulling of blood in the lower extremities. Point number 5. Do not place the client with a head injury in a flat position because of the risk of increased intracranial pressure. So now there is a question for you for critical thinking. So question is, the nurse is caring for a client who is receiving intermittent tube feedings via nasogastric tube. In maintaining proper positioning for this client, what action should the nurse take? Answer will be discussed in the next video.